Everybody to Go Local Live. I'm Josh Fenton, CEO and co-founder. Let's go to the numbers with Dr. Michael Fine. He's the former director of health to the state of Rhode Island. Rhode Island is spiking. Dr. Fine, thanks so much for joining us.
Good to be with you, Josh. Here are the numbers. We are at 126 new cases per 100,000 per week. That is an increase of 3 or 4% from yesterday. We had 210 new positive cases on 7,156 tests. There were no deaths yesterday, but 3 the day before, and 39 people are in the hospital. So we're going up. Hospitalizations are not through the roof at the moment. Thank goodness. Deaths have been, calm, relatively calmer than they were, but the number of infected people continues to rise and rise quickly.
COVID Act Now, who tracks everyone, all the states across the country and all the municipalities and all the counties, has us as one of those high risk areas. It's a couple states in the Northeast, Rhode Island is one of them, and a bunch of states in the South. It is not a grouping Rhode Island wants to be in right now.
No, and this is, I will always say, in terms of controlling this disease, we have two legs to walk on. We've got to work on vaccination first. We got to get everybody vaccinated, but we also have to focus intensively on community transmission and get community transmission as low as we possibly can. Nobody's talking about trying to eradicate or zero COVID, but I think low community transmission makes interchange between people possible and safe. High makes it a little more risky.
We're at over 120 per 100,000. Where do you want to see us?
Well, I want to see us under 5 per 100,000 per week, if we can possibly get there. Under 30 for sure. But we're at 126 and rising. And my guess is if we correct for the number of tests, we're equivalent to something close to 500. As sort of the way we were testing back when the disease was present in Rhode Island with such intensity.
Listen, you've said it before, the time to do extensive testing, where it's most effective, where you can be strategic about response, is when there's a low number of cases. High number of testing when there's an outbreak. Okay, we know everybody's getting infected. Why are we so non-responsive as a state to be able to step up testing when we know cases are increasing and contact tracing might actually work?
I think we may be actually beyond the level at which contact tracing can still work. I can't answer that. I think there's a way to use testing for better disease control, and that is making sure that everybody who works in a congregate setting is tested twice a week, the way the colleges and universities do it. They were brilliant at it. We need to learn from them. And then, as soon as somebody tests positive, pulling them out of general circulation, putting them in isolation so they don't spread the disease. That's a critical and basic public health approach. And I don't get why we're not using it. I think it's because it's expensive, that it's not an easy thing to do. You need an infrastructure, the way the colleges have, somebody to be in charge of that. And either that has to come from, businesses and factories themselves, or it has to be supplied by the Department of Health. For whatever reason, we haven't sorted it out that way. All the testing we're doing is voluntary testing, which doesn't have much public health meaning. It tells individuals who are sick that, yeah, you have this disease, but it doesn't tell us what's happening in the population as a whole.
Dr. Fine, what does the state need to do? Where are we headed if these trends continue? And they appear to be not only meeting our worst case scenario, but exceeding our worst case scenario that we've been raising concerns about over the past month to 6 weeks.
Well, I think we're heading higher and higher, and I'm understanding that we're likely to peak right about Labor Day, which means between now and Labor Day, we have an increasing level of disease and likely, I fear, increasing hospitalizations which are too often followed by an increasing number of deaths. We have lots of reasons for concern. The what's called the R-aught is 8. That means this is a very transmissible virus, 4 times more transmissible than the alpha version was. It's gotten 4 times more transmissible.
And just to put a little context to it, the Raimondo administration flagged that when it was above 1, that was the worry level, right? When it was
Right.
moving above 1, Rhode Island was in trouble. We're talking about 8.
8 times that level of concern. Our community transmission is very high, as we've said. We're, over now, I'm sure, 126 per new cases per 100,000 per week. It's going up, doubling about every 6 days. We are hearing that breakthrough disease, the number of people who get infected despite being vaccinated, is increased over alpha. Alpha was reported at 5%. The Israelis reported it at 12%.
Wait, just 1 second. You're saying that on Delta, the Israelis are finding through their research that it is breaking through on those who are vaccinated, not at 5% like we've been told on Pfizer and Moderna and Johnson & Johnson, but at 12%, correct?
Exactly. And what I'm hearing anecdotally is that it may be higher. We don't have good numbers, and part of our challenge is the many unknowns with Delta. But I'm hearing a lot of breakthrough stories from colleagues and friends, that sort of has my eyebrows raised. And the other thing that sits in the back of our minds ought to be that people who are at high risk, who are quite elderly and frail, who have many chronic diseases, should they get breakthrough disease, they are basically at the same risk that people who are unvaccinated. And so that's where community transmission becomes such a problem, because those people won't get infected if community transmission is low. But at this level of community transmission, going the direction that we're going, we're going to see a substantial number of Rhode Islanders infected, maybe most of the population by the time we're done. And that, for most people, that won't be a problem. It'll be a cold for a couple of days. But for those elderly folks with multiple chronic diseases, even though they're vaccinated, it puts them at significantly higher risk.
Listen, we've been moving through time over the past, say, 6-7 months with the idea of, hey, listen, if grandma's vaccinated, she's pretty safe. We can go over to her house. Sure, the kids aren't vaccinated. I'm vaccinated, but my husband refuses to. But we're not endangering grandma, per se. This data coming out of Israel and information you're receiving from peers is saying that even if grandma's vaccinated, with the Delta variant, you're talking about a risk level that's 2.5 times higher, or maybe 4 times higher, 5 times higher, 20% potentially on the high side who are vaccinated could have breakthrough cases.
And that by itself is troubling, but that combined with high levels of community transmission, that's where the worry is. When community transmission is very low, in the range of 5 per new cases per 100,000 per week or less, or maybe even up to 10, the likelihood of the disease being transmitted and creating breakthrough disease is tiny. But at these levels, where basically there's virus floating around, I don't want to say everywhere, but many places, or will be soon if it's not there already, that exposes people who are vaccinated to the disease, and some of them are going to get breakthrough disease. Flip side is that those who don't get serious breakthrough disease are basically getting, the equivalent of a booster, which is a good thing for the people who don't get seriously ill. But the people who do get seriously ill, that's what you don't want to see happen in this setting.
So the last time we saw a major spike, which was the fall of 2020. The Raimondo administration strategy was, well, until it's functionally out of control in October into November, we're not going to change any behaviors. Halloween's fine, Thanksgiving's fine, Black Friday's fine. And we saw an additional about 1,100 deaths in about 90 to 100 days. To avoid that, what does the McKee administration need to do now? Because if one thing we learned, that strategy didn't work. We ended up shutting down more. We saw far greater loss of life. Rhode Island is now number 2 in the country per capita for deaths per 100,000, for cases per 100,000, and 4th for deaths per 100,000. So we're kind of the worst in the country in managing this disease relative to cases and deaths. How does Governor McKee avoid these same failed strategies?
Well, the time to intervene is now. And, you got to give the governor a lot of credit for his focus on vaccination. Getting more people vaccinated is critical, and pulling out all the stops to get that done, also critical. I think we should be requiring vaccination for all healthcare workers, including CNAs and EMTs, who, those groups are not fully vaccinated as far as I know, and we really need them vaccinated to both protect them and to prevent them from spreading the disease.
So let me just jump in on this point, because it's an incredibly important point. I believe both major hospital groups have said all their employees need to get vaccinated. Simultaneously, they are both wildly understaffed and have posted hundreds of vacant jobs. I talked to a senior member of one of those healthcare organizations, and he said, I don't know what we're going to do. We can't really fire anybody because we don't have enough bodies to get the job done as it is. What's the solution there?
Again, I think the solution is to make that a requirement for working as a healthcare worker, period.
But are you saying if you're the president of Rhode Island Hospital and that nurse won't get vaccinated, she's fired?
I think other places have done it, and I think that's where we have to go. It stinks, but I think that will get us there eventually. I just don't see another pathway for healthcare workers. Remember, healthcare workers have to be vaccinated for a number of different diseases and conditions. This would not be the first by any means. This is expected of healthcare workers, every time we go to work.
The Secretary of Defense is expected to today, tomorrow, require all members of the United States military, I assume that includes the National Guards across the country, to become vaccinated immediately. I think they have 30 or 45 days to get their first shot. Should that same strategy be implemented for all state workers by Governor McKee?
I would. I think that's an important intervention. That's an area over which he has control. And I'd be doing the same thing for municipal employees. So we get the vaccination rate up to 90 to 95%, where it appears to need to be.
Tyson Foods announced that they're requiring all their workers to do so. Immediately thereafter, the unions representing those workers objected to it and claimed that they didn't have the authority to do it. Tyson is sticking with that requirement. We've seen mass numbers of illness and deaths tied to food processing companies, including to Tyson, that have had major outbreaks. Do employers need to, put on their big boy and big girl pants now? Should CVS, should Textron, should major employers across the state of Rhode Island start dictating? We're going to have FDA final approval on, I believe, certainly on Pfizer within 2 weeks. Do these employers need to step forward and start leading and require that their workers get vaccinated or get a new job?
Yeah, I think so. And I think they ought to do it, if they frame it as soon as they have full FDA approval, that gives people a little lead time to get used to it. But I think we'll have full FDA approval, as you said, in 2 to 3 weeks. And then I think there's no further excuse. If you're working in a public place, you need to protect yourself and others. It's sort of like a driver's license. We don't let you drive without a driver's license. We shouldn't let you interact with the public without a vaccination. It's just too dangerous right now. Listen,
we're seeing significantly higher risk because of Delta versus Alpha. We know what the impact of alpha was on the state of Rhode Island, 2,700 deaths tied to that strain of the virus. We have the potential to see an increase in deaths related to the Delta variant. And then our colleague, former pharmaceutical executive Nick, had a very in-depth piece, which we ran yesterday or the day before, breaking down potential new strains that are of risk and showing far greater potential risks to public health and lack of effectiveness in the case of the major vaccines that are in effect. If we can't tackle Delta, are we just bound to future failure over and over again with some potentially far more chilling impacts?
Well, that's what I fear. I mean, I think it's time for us to, as you said, put on our big boy and big girl pants and just get this done. We need to get people masked again. You know, whether we do it as a requirement or whether we do it by moral suasion, by having all our religious and political leaders go to all their constituencies and congregations and, you know, and bug people, remind people, encourage people to mask. To me, that's something that we ought to start tomorrow instead of waiting till we're in deeper trouble. And then we got to get. Go ahead.
Should Governor McKee be wearing a mask as in his operation, in his public appearances, in his press conferences, when he's going to meet people at vaccination clinics? Should he be wearing a mask right now?
My guess is that would help. You know, but I think that's not just true of the governor. That's true of everybody in public office. You know, I think if we all do this, that sets an example for everybody. You know, we got to make it the thing we do while community transmission is high. Listen, the moment community transmission drops to under 50, you know, as far as I'm concerned, we can take the masks off. But for now, we need to keep put the masks back on and keep them on till the number comes down. And then we need to get our testing house really organized, not just increase the numbers, but do it in an organized way. So we are copying what the universities and colleges taught us. You know, if those kids, you know, who are at relatively low risk for serious disease could do it and do it right, you know, they're kids that often come from, I hate to use the word some privilege, or sometimes do, you know, like if they can do it, why can't the rest of us do it? And why can't the rest of us start it soon?
Dr. Fine, you get the last word. What's the next step Rhode Island needs to take, and when do they need to take it?
Well, I think we need to take this disease seriously. You know, we need to take this outbreak seriously, and we need to start, in fact, yesterday or the day before, but certainly get started today and tomorrow. Get started now.
Dr. Michael Fine, former Director of Health, with words of guidance and warnings about the potential impact of the Delta variant as we see it increase cases across the state and across the country. Rhode Island is back in the high transmission level, one of the highest in the country. Everybody stay tuned for many updates. Also stay safe. If you haven't gotten vaccinated and you listen to this interview, I just don't know why you're not running over to CVS and get a quick jab. It's not hard, it's pretty darn easy, and it's gonna protect you and your family, as well as your loved ones and the economy. Thanks, everybody. Stay safe.
Thanks, Josh. Get vaccinated, put on a mask, and get yourself tested twice a week, please.